Neglected tropical diseases, or NTDs, are diseases that affect mostly those living without access to adequate sanitation, basic infrastructure, and health services. In addition to causing significant death and disabilities, these diseases can also lead to stigma, discrimination, and social isolation. In 2014, Regional Director Dr. Poonam Khetrapal Singh included elimination of neglected tropical diseases among her flagship priorities as the region had the highest burden of NTDs in the world. At least one NTD was endemic in each of the 11 member countries. Till today, the WHO Southeast Asia region is the only region to prioritize elimination of NTDs as a flagship priority.
Health equity, universal health coverage, and social justice cannot be achieved without bringing the marginalized population affected by these diseases to the front of the queue. We need to address these age-old health problems to leave no one behind.
Designating elimination of NTDs as a flagship put the spotlight on these neglected diseases. In the subsequent years, the region witnessed high-level political commitment, additional resources, and concerted action on the ground. The region focused on trachoma, lymphatic filariasis, visceral leishmaniasis, also known as Kala Azar, yaws, and leprosy. In 2014, Bhutan and Thailand joined Bangladesh, India, and Nepal to renew a memorandum of understanding with WHO for elimination of Kala Azar. By 2016, India was verified yaws-free. Maldives and Sri Lanka eliminated lymphatic filariasis as a public health problem. In 2017, a ministerial meeting on NTDs in Jakarta, Indonesia, culminated in a call for action to all leaders, policymakers, partners, civil society, and the public in the region and around the world to actively support elimination of NTDs. The same year, Thailand achieved elimination of lymphatic filariasis. In 2018, Nepal eliminated trachoma as a public health problem. By 2019, there was a 43% decline in new leprosy cases with grade 2 disability. In 2020, Myanmar became the second country in the region to achieve trachoma elimination. In 2023, Bangladesh achieved elimination of lymphatic filariasis as a public health problem. It also became the first country in the world to achieve elimination of Kala Azar as a public health problem. The decade not only marked significant achievements against NTDs, but also notable progress against these diseases. Beginning 2018, in line with WHO's recommendation, India, Indonesia, Myanmar, and Nepal started rolling out triple drug therapy to interrupt the transmission of lymphatic filariasis. In the last decade, the Special Program for Research and Training in Tropical Diseases, TDR, and WHO have together developed new innovative tools to support Kala Azar elimination initiative, significantly impacting efforts against the disease. By the end of 2022, 99% of the areas endemic for Kala Azar achieved the target for elimination of the disease as a public health problem. Maldives has become the first country to interrupt the transmission of leprosy. Bhutan and Maldives have reported less than 25 new leprosy cases annually since 2013. In 2020, in what is being described as a game changer in the region's effort to eliminate leprosy, a new single-dose post-exposure prophylaxis regimen recommended by WHO was rolled out by member countries. Across the region, there has been a 20% reduction in the population requiring interventions against NTDs, a significant contribution to SDGs and global targets of WHO. Elimination of NTDs will mitigate poverty, SDG 1, and improve health and well-being of almost 1 billion people. Despite the COVID-19 pandemic, member countries continued efforts against NTDs with innovative approaches and strategies. preventive chemotherapy against NTDs was rolled out to 462 million people throughout the region in 2021. A new regional strategic framework for accelerating and sustaining Kala Azar elimination in Southeast Asia 2022 to 2026 is now being rolled out.
By eliminating NTDs, member countries are giving their people a future free from debilitating and stigmatizing diseases and truly leaving no one behind.